I come back out of that nosedive, and they say, Derek, congratulations. You are in remission. We feel like we've gotten everything. During the chemotherapy, they hung all of my meds from a bag on a pole and dripped them into an IV into my arm. But there was one drug in particular that they couldn't do that with. It was a little too toxic. And so it was a longer infusion where the nurse would sit there with her thumb on the plunger and just sit there and we'd talk, we'd have a conversation. And over the course of, I forget, it may have been a half an hour infusion, she would just push the plunger in slowly and she'd say, all right, Derek, tell me if you feel like this has gotten outside of your vein. Because if it does, there's a chance that this could damage your heart. It could get into your bloodstream and attack your heart, and we don't want that to happen. The likelihood of that happening is like 2%. And immediately, 2% starts ringing bells in my head. And I'm like, well, okay. And they said, listen, Derek, quite honestly, we know more about hearts than we do about cancer. So if for some reason this does affect your heart, we'll cross that bridge when we have to. Right now, this is your best treatment to cure you of cancer. And so that's what we went with. And so after 5 months, they're like, congratulations, you're in remission. And my wife and I kind of look at each other. We take that collective sigh of relief. And I'm like, all right, I don't have to come back here except for checkups from here on out. And they say, listen, go. If you can make it for 5 years with clean scans and clean blood tests, then that is your big red letter day. Make it to 5 years, and we can safely say that it's not going to come back with a high degree of certainty. Of course, that 2% was still ringing in my head. So I go back to work, and it's around this time that I'm starting to feel like, oh, okay, well, I can work. I can start working out a little bit, start feeling better. And around that same time, my company had started expanding. So the company wasn't just interviewing oncologists. They started taking on cardiology work. And so I'm like, great, all right, put me back on the road. I want to go start interviewing cardiologists about, heart disease and heart failure and all these things. And I'm thinking, man, people who have heart failure and heart disease, that's really rough. Those poor bastards. And 3 months into being back at work, I'm walking up this hill between the parking lot and the office. And it's a hill that I'd taken hundreds and hundreds of times before. And I get halfway up the hill and I have to stop. And I'm like, and my breathing sounds like the saliva suction tube at the dentist's office. It's all snap, crackle, pop. And I'm like, oh, that's weird. I just got through with cancer. I don't want to go back to the doctor. I'm just going to ignore this. And so I did. And I got up to the rest of the hill and I went to work. And I'm feeling crummy. And I go through a few weeks of that, and my wife sees it happening. And she's like, really? Don't make me tell you. And I'm like, yeah, you're right. So I'll go. And usually this happened late at night, 2 a.m. when I couldn't sleep because I was having trouble breathing. And so she would wear me down to the point where I would actually agree to go to the emergency room. And so I would go to the ER, and at first they think it's pneumonia. Well, it wasn't pneumonia. They treat me for pneumonia, but the breathing issues are still there. And so I go back every couple weeks with the same issues, and I would describe it as having a 10-pound weight hanging from each lung. It wasn't that big a deal, but it was just it took more effort to breathe. And then they thought it was pleurisy. They thought there was fluid buildup in my lungs. And then my hands started getting really heavy, and my head started getting heavy, and I would get these dizzy spells. One of the office buildings that I worked out of was a third floor walk up. And I'd get to the top of the landing on the first floor and I'd be like, okay, I'm just going to stop here and take a break, take a breather. And then I'd walk up the rest of the 2 flights and it would just get worse and worse and worse. So after a couple months of experiencing all these issues, I'm at the ER overnight, late at night again, and this new doctor comes to my bedside after a whole new series of tests, and he introduces himself as a cardiologist. And he says, Derek, I understand that you've had a pretty rough year, but I'm afraid I've got some more bad news. You've got heart failure. And do you understand what ejection fractions are? No clue. Okay, so ejection fractions are the efficiency at which your heart pumps oxygenated blood through your system. Your body needs oxygenated blood, needs oxygen. Normal ejection fraction, or EF, is somewhere, for a normal person, is somewhere between 55 and 65%. That's normal. Right now, yours is at 18%. And it's a little subjective, but the cutoff to go on the heart transplant waiting list is 17%. It's not an exact science, but you're right in that range. And so, I had been going to late night ER trips so often. And early on, I would always call my parents. My wife would always go with me. But, I would call my parents to let them know, hey, I'm in the ER again. I'm all right. Something's weird, but it's okay. I had been going so often that I'd just stopped calling them. It was a normal occurrence to be in the ER overnight. And it was just a pain in the butt. So at that point, the doctor says, if you need to call anybody, you might want to do that. And I did, and I called my parents and I broke down and I said, it's not over. There's something else. I've got heart failure. And so I gathered myself, and my wife was there with me, and my parents came in, and I found out all about heart failure and what I needed to do to live with it. And I basically said to my doctor, I said, okay, what's next? What do I got to do? Put the blinders on. What's the next step? So the next step was treating me with medications. And hopefully those medications would control the arrhythmias, the abnormal beats that my heart was getting because it was weaker. Because the heart was weaker, it was growing in size. So it was dilated cardiomyopathy. And those dizzy spells and feeling weak and lethargic and not able to lift my hands or my head, I also developed a nagging cough. And everything just continued to worsen a little bit. But I just kept moving forward, and I took my meds and tried to manage my condition with medications. And around December of that year, my cardiologist said, we're not able to manage. One, we were hoping that the medications would bring your ejection fraction back up to maybe 35, 40%. Get it out of that danger zone. Well, it's not increasing any. So you're still getting the abnormal heart rhythms. I'd like to put in a defibrillator pacemaker just to make sure if anything were to happen, you've got that backup. And so December of 2004, that's what I did. I had a pacemaker defibrillator implanted in my chest to make sure that if my heart indeed stopped, that it would thump me and I'd keep going.